Hey, it's Chris Byer,
Chris Bowling. What's up, CB?
ACB. We've got a special guest with us this morning. We've got Nicole from ScriptSourcing. Nicole, welcome. Thanks for joining us in
Awesome.
Focus.
Good to see you.
Thanks for having us.
So, Nicole, if you wouldn't mind, tell us a little bit about who you are and your background in the insurance and employee benefit industry.
Yeah, absolutely. So Nicole Elover, I'm a national sales executive at ScriptSourcing. And I actually started with ScriptSourcing as a member advocate. So I had
Okay.
the opportunity to speak directly with members, help them enroll into our pharmacy programs. But over time, I've transitioned to the sales side, and now I'm a national
Yes.
sales executive.
Awesome.
Excellent.
Congrats.
I know we've worked with ScriptSourcing for many of our self-funded clients, helping source medications at a much reduced price than the traditional methods, helping provide no cost prescriptions to members, really helping families save money. Would you give a little bit of the ScriptSourcing story as well? You probably can say it better than we can in terms of really what you do and how you're helping both self-funded health plans and their members from a cost standpoint.
Yeah, absolutely. So, ScriptSourcing is a risk management company, and we really help self-funded employers to better manage risk. As you
Yeah.
kind of alluded to, our bread and butter has historically been in the pharmacy space, to help
Yes.
members receive their expensive name brand med and specialty meds for a $0 copay, all while helping to save employers about 50 to 70% on their healthcare spend.
Yeah.
So that's kind of been our bread and butter. But outside of the pharmacy space, we really have evolved into being a full risk management solution provider to offer a
Yes.
whole suite of solutions to help self-funded employers better manage risk.
Yes, we agree.
Yeah, we just had this morning before we jumped on, we had an email from a client, took a medication from what, $6,500 down to $1,500 on the health plan, and the members receiving that for no copay, no costs.
Huge.
I mean, that's a huge win. I mean, to be able to say to an employee or their family, we're going to provide this at no cost to you. It's free healthcare for making the right choice. I mean, it's a huge success. But you did mention though you're expanding beyond pharmacy,
Right.
which we're starting to dive into some of those things while we met you and the team related to pharmacy. What do you see really for the future when you talk about some of those other risk management opportunities for a self-funded health plan? Where do you see ScriptSourcing going, into 25 and beyond?
Yeah, I foresee the future of ScriptSourcing to continue adding on additional strategies to our suite of risk management solutions.
Yes.
We are an innovator in the healthcare industry, and we definitely look forward to continuing to be a pioneer in the space to continue developing new ideas and new solutions.
Yes.
Yeah, and I think that's what's been encouraging is we've seen some of that suite evolve too. Is you plug in what works. It may be something we've never thought of as a way to control costs to offer free benefits to the employees, but if it comes around and it's viable, I think your team's going to jump on that, which is awesome. Chris, I know as we've worked through this, we're starting to see, I think using Nicole's words of risk management, more of our clients and new clients looking at how are they controlling cost by just managing each of those components of their self-funded health plan and not relying on what's always been done to make things work out. And it's been a good thing for their budget, but also for their employees.
Yeah, I think what's exciting is the more we understand where you fit, Nicole,
Yeah.
the better we are learning where and how to make it fit. I mean, as we all know, there are big ASO plans. You can't carve out the pharmacy. You're stuck with who you are, good and bad. And I think that's what has Chris and I so excited about the future is, what we thought was one model is now turning into multiple models of, okay, if we can't do this, but could we do this? And that's where I think you and your team are just excellent, is you're giving us that advice, you're giving that guidance. You do a wonderful job explaining it to our clients. So it's not us trying to tell them your story. We
Yeah.
truly cannot say enough about how impressed we are. It's working perfectly.
We value the partnership. It's been fantastic working with you and your team.
Thanks, Nicole. Well, Chris, as we're wrapping up this morning with Nicole, I know you've got your famous question you like to ask.
Yeah, and I'm going to tweak it a little bit, right?
Okay.
Because knowing the industry you're in, what is a quote that helps our viewership understand what you're doing on a day-to-day basis?
Well said.
Yeah, this is one of my favorites. When employers can empower their employees to be great consumers of healthcare, care can be offered for free or nearly free, all while saving money along the way.
Yeah.
And a lot of times people don't understand that you can have both. You just
Right.
have to empower your employees, educate them, and provide the right resources in place.
Well said.
That's well said. Well said. And I think it's shifting what we've always known in the industry, that the only way to save money is to push more to the employee and their family. And that's a broken model that
Yes.
doesn't need to be replicated anymore.
Right. Also well said.
Well, thank you, Nicole. We'll go ahead and make sure that we tag you in ScriptSourcing when we put the video up and highlight some of that. So we've got opportunity for people to connect with you as they're looking at opportunities to work with you.
Yes.
Fantastic. Thanks for having me.
All right. Thanks, Nicole.
Thanks, Nicole.